Hi everyone, this is Ramya from TechEduMaster near MOSC Medical College, Kolancheri. So in this video, I would like to give some information regarding how to select case note while you are writing a letter. Okay, so there are definitely in a case note there will be relevant informations and irrelevant informations, because irrelevant informations will be provided in order to misguide you. So you need to understand what is relevant and what is irrelevant. It always depends upon the reader and the purpose of the letter why we are writing. Okay, so the first thing what you have to do when you get a case note is that you have to go to the bottom of the case note where you can find writing task. By reading the writing task, you will be able to understand who you are and to whom you are writing and why you are writing this letter. Unless you understand these 3 points, it is really very difficult understand what is relevant, what is semi-relevant and what is irrelevant. Okay, so you need to understand to whom you are writing, who you are and why you are writing. So how to decide what is relevant and what is irrelevant? So once you get the question paper and once you understand who is the reader and why you are writing this letter, you need to go through the case note. Okay, you need to go through the case note and decide what are the informations which is necessary for the reader. What all informations will help the reader to provide an accurate care for the patient. Okay, so you have to take case note and understand what all are these informations which will be helping the reader to help this patient. Okay, those informations which will help the reader to help the patient. Okay, so there can be some irrelevant information, so that means that informations which are not directly related to the care of the patient. Okay, for example, at some cases, medical history is quite important in order to give care for the patient, whereas in certain other cases, medical histories are not that relevant. So you need to understand what is relevant and what is irrelevant. So I can give you some tools which will help you to find what is relevant and irrelevant. The first one is that you have to understand the guiding questions. What are these guiding questions? Like who you are, to whom you are writing, what is the purpose of this letter, and what is the key information in the case note. And the last one is that what all informations are relevant to the purpose. Okay, so these type of questions should be there in your mind when you are going through this case note. Okay, this next method is about ISBAR. I think you have heard about this method, ISBAR. ISBAR means it is a type of method which you can apply in order to get relevant case notes and in order to organize your information in the letter. So in ISBAR, I stands for identify. You need to identify the name, age and how you are connected to the patient. The second, yes, means situation. Situation means the purpose of this letter and the main medical issue of the patient. Next thing is background. Background means the relevant medical history or social history has to be find out relevant. Okay, the next one is A, is bar A. A is for assessment. Assessments means how the patient is now and what all treatments is needed for the patient in order to improve his condition. So these information should also be collected. And the last one is recommendation and request. That means what the other person, what the reader needs to do for this particular patient. So either you can go with this method, this will really help you, ISBAR method. Okay. Yeah, so I'm going to give you some tips, top tips for writing or selecting case notes. The first thing is like you have to look at the writing task. The first thing, when you get a question paper, you need to go to the writing task and understand to whom you are writing and why you are writing. Keep in mind the reader always. Whenever you are writing this letter, all throughout the letter, you should keep in mind about the reader and what all information needs to be known to this particular reader. Next one is that you should be clear about the request that you are going to give to the reader. Okay, so these are some important tips which I would like to share with you. I hope it's clear. Take care. Thank you.